when we talk about the difference between the first two vaccines that we've been utilizing since December 2020 and the new vaccine, which is the Johnson Johnson Janssen vaccine, is really parts of where the vaccine takes effect. And so the basic premise behind a vaccine, again, is really just giving a bit of information to our bodies. And I like to think of that as like a picture or a photocopy of something that enters our body that shouldn't be there. And with the vaccines of the Pfizer or the Moderna, we are giving essentially a piece of information that our body takes and then runs it as a photocopier, and then runs off a number of different pictures to let our cells and our various organs, our muscles and tissues to know that if this bad villain were to enter our body, that we could mount a response to say, nope, you can't be here, you got to go. And with the Johnson Johnson vaccine, we're utilizing a similar technology that we've used for decades and we've used in other forms of vaccine technology. What we're doing is we're taking another virus called an adenovirus, which is something similar to the common cold, just as this coronavirus is. But what we're doing is we're breaking up that virus a little bit further. So one, that it can't produce any harm to us itself. And then we're also adding the bit of information that is really important, how these vaccines are working for us to identify when corona virus enters our body. And so the Johnson Johnson is giving that virus that we can inoculate in our arms, and then allow our bodies to make the machinery a little further upstream, not to get too far in the weeds, but it goes into some upstream mechanisms that allows us to produce that photocopying process for that protein that our body can recognize and build up. This is with the newer technology, the mRNA, the makers of those vaccines utilize a process where they did a primary vaccine and then they did a booster, and we use this for many different vaccines. However, with this new vaccine, the Johnson Johnson, it does afford us, and it looks like with the research, that the efficacy and the ability just to give a single dose is an upside to this vaccine. And it is one of the positives that I would say in our ability to combat this pandemic, is that rather than having to give 2 shots, we simply can give 1. Where the trials and studies and research were done for these different vaccines makes a big difference and when we talk about efficacy. So the Pfizer and the Moderna vaccines were studied very early on in the pandemic, and the reason I bring this up is because we've all seen in the media and the news is that we're seeing variants and we're seeing alterations in how this virus can infect us. With the Johnson & Johnson Janssen vaccine, we are much further down the line, and also in some communities in other countries, I would add, such as the United Kingdom, South Africa, and in those locations, there were variants that were different. So the efficacy, when we're talking about that, we need to be sure that we're aware of the implications of that. So when we talk about the efficacy, the studies show that Johnson & Johnson had a 66% efficacy as far as reducing the incidence of infection from COVID-19 virus. But one thing I will highlight is that in a major thing we need to really point out is that this vaccine, the Johnson & Johnson, prevented essentially 100% against death, and really a remarkable efficacy when we're talking about severe infections. And so that is, ultimately what we really want on a vaccine is make sure that nobody's going to be seriously harmed. And that's the difference with this. Now, when we talk about the Moderna and the Pfizer, the initial studies did show that the efficacy of contracting the virus is 95%. So all 3 vaccines, I think the bottom line is highly effective and very just excellent research, and we're at a great spot with any of them. All three of these vaccines are very efficacious, and when you have the opportunity, I would not bat an eye at either one among the three. I would just simply get vaccinated because they are all quality and well researched. I think that's very important to point out, perhaps some other vaccines that we're more familiar with. And so the influenza vaccine is certainly something we're all very accustomed to, being that it is an annual vaccine. And so when we look at that, there are some nuances and differences among these different types of viruses, such as the influenza virus. But that is why we speak to the efficacy of the COVID-19 vaccines, is that they are very efficacious, because usually our influenza vaccines, because of the changes that occur so quickly in that, are only on the order of 40 to 60% effective of reducing influenza being symptomatic. Not to say that that is not an important milestone for the influenza vaccine and how they promote that. It is also a very effective vaccine in a public intervention that we also still need to maintain. But it just speaks to the value that the COVID-19 vaccines, and all three of them, even the J&J being 66% effective, being very important treatment modalities for us to prevent infection. We're very early on in seeing what the side effects are, but they mimic and really parallel with what we're seeing with the other two vaccines. So first being, at the site of injection, sore arms. People are demonstrating, some fatigue, perhaps some mild, what we would call normal responses for our immune system, and show that it is working. So we're building up some of the blood cells that we need to help prevent infection, and so comes along with that. Could be some body aches, muscle aches, fatigue, and fever could be some of the symptoms that people might experience following that. Now that we're getting communities that are, and hopefully once we reach, population immunity, or what we call herd immunity, the idea is the question is going to come up, can people pull back on some of these interventions, these public health interventions? And, I think that the answer will be is that, our hope is that we will return to kind of normal. But when and where that is, I think is premature to say at this point. We still have a long way to go, and we still have a great number of people to vaccinate. So even though somebody has had a vaccine, it affords them their immunity. However, these vaccines, as we just talked about this morning, are not perfect, and so there is some breakthrough. And so 95%, even in our first two vaccines, is not 100%. And so using a mask, maintaining distance, washing our hands, being thoughtful in the locations that we are, and our behaviors, and when we're around other people, are still very, very important for us to make sure that we can continue to fight this pandemic and continue to improve outcomes for all our community members, and locally and abroad. And the other thing I will mention is that we are very fortunate in this country. We've had a really strong response in vaccinations, but as we see that there are variants starting across the world, there might be more changes. And so we need to be cautious with that too, because there will be travel, there will be people that will be coming from other countries that are not vaccinated as well as we are. And so our precautions still need to be maintained for that level of security.